Hey guys, it's Dr. Ariana here, and I want to talk to you a little bit about our weight loss program here at Tula Wellness. I started this weight loss program a little over a year ago, really because I personally have been using semaglutide for the last 3 years now, and I had really great success with it. I have a strong family history of diabetes and hypertension. I noticed that my blood sugars were going up. My hemoglobin A1C was indicating that I was borderline diabetic. And so I started this medication, really more to be a little bit more proactive about my health, but I also wanted to lose a few pounds. My dad had been on it, and I noticed he had had some amazing weight loss, more than I'd ever seen before in his weight loss journey. So I started this medication. The brand name of semaglutide is called Ozempic, and it's really all the rave now, but this drug has been out for several years. It actually has been slightly modified from its original composition, and that drug, the brand name was called Victoza, and that was a daily injection. So they just made a couple of changes to it, and now it is a weekly injection. That said, it is not generally covered by insurance these days if you are not diabetic. And so what we did is we were able to acquire this medication, and basically it is the generic form of the Ozempic, and we have branded it SimSlim. So how does it work? It is a GLP-1 agonist, and GLP-1 agonists have lots of mechanisms of action. First thing they're going to do is decrease or delay gastric emptying in the stomach. What this does is increases the feeling of satiety. You just feel full because you are full, because your food is literally staying in your stomach longer than usual. It also increases your sensitivity to insulin. It decreases the release of glucagon from the liver. Glucagon is basically sugar. But what it also does, which I find fascinating, is it works in the brain center, and it really does help, right? It just affects what we call the food chatter, the food noise that's in our brain. It decreases the enjoyment, for lack of a better word, that you feel when you're eating food. So it has all of these mechanisms of action that ultimately result in decreasing your blood sugar, decreasing your fasting insulin levels, decreasing your weight, and at the end of the day, it works really well as a medication. The side effects of the drug can include, but are not limited to, nausea, heartburn, constipation, and just overall GI upset. One thing I definitely noticed while using this medication is that you just don't have the same joy of eating that you might typically have. And so the cravings go away, those sugar cravings, those munching cravings, those are all gone. That's what I most commonly hear from patients. Even they're using it now, studying it in patients for addiction, alcoholism, because it really is affecting how our brain is processing some of this. We've had great success with it. My office manager has lost about 60 pounds over a year and kept that weight off. Several people or patients have been on this medication over the years, and is by far, it's my favorite medication. The only contraindication really is a family or personal history of medullary thyroid cancer or medullary endocrine neoplasia, which is a very, very rare condition. We typically will have you come in, you will have some labs be drawn. I'll be looking at your fasting insulin, your glucose levels, your hemoglobin A1C, and just making sure you don't have any other significant issues that we need to bring to your attention. We're also going to be looking at your thyroid and your cholesterol. So at the end of the day, this is really just to give you a little more of a reference point about where you are in your health and knowing your numbers. We'll be obviously weighing you, measuring your hip, your waist, and really showing you all the different ways that you can modify how you're eating. So we'll be offering you all the different standard diets, the Mediterranean diet, the paleo diet, the DASH diet, and the food elimination diet, which is a diet where we're going to help you see what are those food sensitivities that you may have that you don't even recognize. So I hope that gives you a better understanding of how this medication works. give us a call at the office and we'll be happy to help you on your weight loss journey.